welcome to the Deep Dive. Today we're diving into something really interesting, actually, a question from a listener.
Oh, yeah. What's the topic?
It's about hyperbaric oxygen therapy and how it helps with carbon monoxide poisoning.
Ah, okay. That's a great one. Important stuff.
Yeah, and the listener wanted to, get a solid grasp on it quickly without getting bogged down in super technical details.
Makes sense. It can sound complicated, but the core ideas are pretty accessible.
So that's our mission today.
Mm.
Unpack this therapy, figure out what it is, and specifically how it tackles carbon monoxide poisoning, drawing on what the science tells us.
Exactly. We'll break down how it works, focusing on that specific use case, carbon monoxide, based on the research about the process and application.
Okay, let's start at the beginning then. What actually makes carbon monoxide so dangerous? We know it's a gas, obviously, but what does it do?
Well, it's particularly sneaky because of how it interacts with our oxygen transport system.
Okay.
Specifically, it has this incredibly strong attraction to hemoglobin, the protein in our red blood cells.
All right, hemoglobin carries the oxygen around.
Precisely. And the thing is, carbon monoxide binds to hemoglobin about 250 times more strongly than oxygen does.
Well, wait. 250 times?
Yeah. It's like it has this super glue grip compared to oxygen's normal hold.
Yeah, just muscles oxygen out of the way and grabs onto the hemoglobin.
That's a good way to put it. It latches on so tightly that the hemoglobin basically can't pick up oxygen anymore.
Okay, I see. So the red blood cells are still circulating, but they're carrying the wrong passenger, essentially.
Exactly. They're full of carbon monoxide instead of the oxygen the body needs. So oxygen delivery to tissues and organs just plummets. It really disrupts the whole system.
That makes total sense. If hemoglobin's job is blocked, oxygen doesn't get delivered.
Yeah.
I think I read something about it binding to myoglobin in muscles, too. Is that also a big part of the problem?
That's mentioned in the research, yeah. It can bind to myoglobin. But honestly, the main immediate life-threatening issue with carbon monoxide poisoning is really its effect on hemoglobin and oxygen transport in the blood. The myoglobin aspect is still something researchers are looking into. It seems less understood compared to the hemoglobin impact.
Gotcha. So the critical thing is the oxygen not getting to where it needs to go via the blood. Does the body, try to compensate at all?
That's a good question. Sometimes the body might react by increasing blood flow, particularly out towards the skin and limbs, trying to get something circulating, perhaps.
Right.
But here's the kicker, that increased peripheral flow doesn't necessarily mean more oxygen is getting to the really vital organs that are suffering the most. It can sometimes even, paradoxically, draw resources away from where they're most needed.
So it might actually make things worse for the important bits.
Potentially, yes, for those critical areas.
And which organs feel the effects first?
Well, think about which organs need the most oxygen constantly.
The brain and the heart.
Exactly. The brain and the heart have incredibly high oxygen demands, so they're often the first and hardest hit when oxygen supply is compromised like this.
That's pretty scary. What kind of symptoms show up then, if the brain and heart aren't getting enough oxygen?
The research points to a range of issues stemming from that lack of oxygen, what's called tissue hypoxia. So you might see things like kidney failure, heart failure, in severe cases, even coma. Fluid buildup in the lungs can happen too.
Wow. That's a broad spectrum of really serious problems.
Oh, yeah.
And it sounds like it's not just the immediate lack of oxygen either. I remember reading something about longer-term damage.
Yes, that's a really crucial point. Carbon monoxide doesn't just suffocate tissues temporarily. It can also directly injure the tissue itself and the nerves around blood vessels.
Injury? How?
It seems to cause inflammation and other damaging processes. And this kind of injury can lead to persistent neurological problems down the line. Things like memory issues, trouble concentrating, maybe problems with coordination.
So even if someone recovers initially, they might face these lasting effects. Okay, this paints a really serious picture, which brings us back to the therapy. How does hyperbaric oxygen therapy actually step in to help?
Right. So hyperbaric oxygen therapy, or HBOT, the basic idea is quite straightforward, actually. It involves having the patient breathe pure 100% oxygen.
Okay, pure oxygen.
While they're inside a special chamber where the air pressure is increased to be higher than our normal everyday atmospheric pressure.
Higher pressure.
Mm-hmm.
Pure oxygen. Okay, I'm starting to see how this might be different. What does that combination do?
The key effect, the really important one, is that this combination dramatically increases the amount of oxygen that dissolves directly into the liquid part of the blood, the plasma.
Ah. Not just what the red blood cells carry, but dissolved in the blood liquid itself.
Exactly. Normally, hemoglobin in red cells does almost all the oxygen carrying. But with HBOT, because of the high pressure and pure oxygen, you force a whole lot more oxygen to dissolve straight into the plasma.
So it's like creating an extra oxygen reservoir, bypassing the blocked hemoglobin.
That's a great way to think about it. This extra dissolved oxygen can then get delivered to the tissues even if the red blood cells aren't working properly because they're full of carbon monoxide.
It sort of floods the system with usable oxygen.
Precisely. The sources often use that exact word. It floods the body with oxygen under pressure, getting it to tissues even if blood flow is sluggish or the normal carriers are busy.
Okay, flooding. I like that visual. So how does this flooding specifically counteract the carbon monoxide poisoning then?
Well, it works in a couple of key ways. First, that huge concentration of oxygen in the blood helps to basically push the carbon monoxide off the hemoglobin molecules.
Oh, like outcompeting it.
Exactly, it's a competition. With so much oxygen around, the bond between carbon monoxide and hemoglobin is more likely to break. The CO gets kicked off, freeing up the hemoglobin to start carrying oxygen again, and much faster than it would naturally.
Right, okay. Displacing the bad stuff. What's the second mechanism?
The second big benefit is just simply delivering much, much more oxygen directly to those oxygen-starved tissues.
Tackling the hypoxia directly.
Right. It directly counteracts that dangerous lack of oxygen caused by the carbon monoxide, giving the cells the fuel they desperately need to function and hopefully start recovering.
So a two-pronged attack, kick the CO off the bus, and deliver extra oxygen directly to the destination. Makes sense. You mentioned the brain being particularly vulnerable. Does the research say HBOT helps the brain specifically?
Yes, it does. Several studies we looked at suggest HBOT can help restore the brain's ability to regulate its own blood flow after CO poisoning.
Why is that important? Regulating blood flow.
Well, it means the brain can better control getting the right amount of oxygen and nutrients to different areas as needed. If that regulation is damaged, recovery can be hampered. So helping restore that is quite significant.
That sounds really positive. What about those long-term neurological problems we were talking about earlier? Any connection there?
There's research indicating that HBOT might actually reduce the frequency or severity of those delayed neurological issues, the memory problems, concentration difficulties, and so on.
Really?
The thinking is that by improving oxygenation and potentially reducing the initial tissue damage and inflammation early on, the therapy might help prevent those downstream long-term problems from developing.
That's a really significant potential benefit, beyond just surviving the initial event.
Definitely.
Are there any other, maybe more microscopic ways it's helping at the cell level?
Interestingly, yes. Some studies even suggest HBOT might inhibit a damaging process called lipid peroxidation.
Lipid peroxidation. Okay, what's that in simple terms?
It's basically damage to the fats, the lipids, that make up cell membranes, especially in the brain. They're crucial for cell structure and function. Carbon monoxide seems to trigger this damaging process,
Okay.
and HBOT appears to help counteract or inhibit that specific type of damage.
Wow. So it's not just flooding with oxygen, it's potentially protecting brain cells from a specific type of chemical damage caused by the CO.
That seems to be part of the picture, yes. It suggests multiple levels of benefit.
Okay, this therapy sounds quite powerful. So if someone actually needs this treatment, what does it look like? What do they experience?
Well, the research gives a general overview. Typically, it involves sessions where the patient lies inside a specialized chamber.
Right, the pressurized chamber.
And inside, they breathe 100% oxygen through a mask or a hood, while the pressure inside that chamber is gradually increased.
How high does the pressure go, and for how long?
It varies. The protocols depend on the specific situation, how severe the poisoning is, and medical guidelines. But the pressure is often increased to, say, 2 or 3 times normal atmospheric pressure.
Okay.
And a session might last maybe 90 minutes to 2 hours, something in that range. Sometimes multiple sessions are needed.
And during that whole time, just breathing pure oxygen continuously.
Not always continuously.
Yeah.
Some protocols involve periods of breathing the 100% oxygen, interspersed with short breaks where they breathe regular air.
Oh, air breaks. Why?
It's mainly a strategy to manage the potential risk of oxygen toxicity.
Oxygen toxicity. That sounds weird. How can oxygen be toxic? We need it.
It is a bit counterintuitive, but it turns out that breathing very high concentrations of oxygen, especially under high pressure for extended periods, can sometimes have side effects.
Like what?
Well, the pressure changes themselves can sometimes cause ear discomfort, like when you're flying or diving, that's usually manageable. But with prolonged exposure at very high pressures, there's a small risk of effects on the lungs or even the central nervous system. The air brakes help minimize that risk.
Okay, so it's about managing the dose, like with any potent therapy. Too much of a good thing, potentially.
Exactly. It's generally considered very safe when administered correctly by trained professionals following established protocols. But like any medical treatment, there are potential side effects to manage.
Makes sense. Are there other safety things to consider with these chambers?
Absolutely. Safety is paramount. The research really highlights the strict protocols, especially concerning fire risk.
Ah, right. Pure oxygen and pressure. Sounds like a fire hazard.
It definitely increases the fire risk. So everything used inside the chamber, equipment, clothing, bedding, has to be carefully selected or modified to be safe in that high oxygen, high pressure environment. No sources of ignition allowed.
Specialized equipment is key then.
Totally. And the staff operating these facilities receive extensive training, not just on the therapy itself, but on all the safety procedures and emergency management. It's a highly specialized environment.
Okay, so specialized equipment, trained staff, specific protocols. It's a serious medical intervention.
Definitely.
Well, this has been incredibly helpful in understanding how this all works. To kind of sum it up for our listener, what's the main takeaway message?
I think the key takeaway is that hyperbaric oxygen therapy is a really powerful tool against carbon monoxide poisoning. Its main strength is boosting oxygen delivery to tissues dramatically.
Right, getting oxygen where it's needed despite the CO.
Yes, and secondly, actively helping to remove the carbon monoxide from the hemoglobin much faster than the body could do on its own.
So it leverages physics pressure and gas concentration to overcome the biochemical problem caused by the carbon monoxide.
That's a perfect summary. And as we discussed, the evidence also suggests potential benefits beyond that immediate crisis, like protecting the brain and possibly reducing long-term complications.
And for anyone listening who's now really curious about the nitty-gritty details, specific pressures, treatment schedules, the history, maybe even other uses for HBOT, the scientific literature is where they need to go next.
Absolutely. There's a vast amount of detailed research out there for those who want to dive even deeper.
It definitely makes you think, though. As we get better at understanding how to use oxygen therapeutically, under different conditions, what other conditions involving oxygen starvation or tissue damage might benefit from approaches like this in the future? It's a really fascinating field.
It really is. Constantly evolving.
Well, thanks so much for breaking that down with me today. Really appreciate it.
My pleasure. Glad to talk it through.